Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weisheit, licensed clinical social worker. Thank you so much for joining us. However you may be joining us, we appreciate it. I'm very glad to have back with me Dr. Kalisha Hanley, DDS, a dentist. Thank you so much for joining us.
It's my pleasure.
I appreciate it. And with Tesh Action.
Yes, with Tesh Action Clinic.
City.
Yes.
Very good. So we're very glad to have you. You're one of those people I know people ask lots and lots of questions on, but I think you get quite a few questions about root canals. And I guess first and foremost, why don't we let people know what a root canal is? Because I don't know that people always understand the specifics of those kinds of things.
Root canals have such a bad rap. The minute the word root canal comes out, I get all kind of faces. But firstmost, the root canal is the last resort to save a tooth without it being pulled.
Okay.
So the root canal, it's a friend. It's a way of keeping your teeth. A root canal is simply removing the infected nerve out of the tooth and replacing it with a filler. So let's go back to dental basics.
Okay.
So with the tooth, there are 3 layers. You have the outer layer, which is the enamel.
Right.
The middle layer, which is the dentin. And then you have that core layer, and that's where your pulp is. That's where the nerve is. So if you have a cavity, and the cavity is in the outer layer, or it just gets in the middle layer, then we can just treat it with a filling. But if that cavity grows, if you procrastinate from getting that cavity done, it grows and it gets towards that core layer. And that's when you start feeling the sensitivity and getting the toothaches. At that point, it's irreversible pulpitis, and you cannot get a filling. Then you need the root canal.
And so people hear root canal and they just automatically almost always cringe.
Yes.
But a root canal is actually saving the tooth.
Yes.
It's the last step to save the tooth.
It's the last step. A lot of people think that it's painful. And I want people to know that root canal does not mean pain. The pain comes from infection. Infections is what causes pain. I have patients that tell me that, no, I want to get the tooth pulled because they feel that the root canal will hurt. And I tell them, if that infection is present, even if I were to pull it, you would still feel discomfort. When infection is present, the anesthesia cannot properly penetrate and permeate throughout the tooth. So even though your whole side of your face feels numb, like it's going to fall off, if I touch the right area of that tooth, you're going to feel it. And that's because of the infection will not allow you to get fully numb. So to combat that, what I do, I put you on antibiotics days leading up to your appointment. And I keep you on it during the appointment and days afterwards. Because if the antibiotics can localize that infection, it will allow that anesthesia to work a lot better. And then you're going to be really comfortable. And then you will smile when you see what the root canal can do.
And so, quite frankly, it's a kind of misdirected view of where the pain is coming from.
Exactly.
The pain is there because of the infection. The root canal needs to be done because of the infection.
Yes.
And it's because of the advanced infection because you have to do the root canal rather than just getting a filling.
Absolutely.
And so that's one myth about the root canal.
Yes.
Is that it really, really hurts. And quite frankly, you're treating the root canal's infection before you ever do the root canal.
Exactly. And
So
that's how you give the patients a more comfortable experience.
Okay. And so what's the second thing that we want people to know or dispel about a root canal?
I have had patients and they tell me that, Doc, you're right, the root canals don't hurt, but I had some before and my tooth broke. It didn't work. And so I let them know the first thing, root canals work, but the caveat is you have to have a crown on the tooth afterwards.
You got to take the next step.
You have to take the next step. And what I've learned, a lot of times they weren't informed or they weren't compliant.
Or both.
Right, exactly.
They heard what they wanted to hear and or they didn't follow up.
Exactly. And I say that because when we remove that infected nerve and we get it out of your mouth, that's the way we can keep the tooth in the mouth. But it's still going to be restored, but it's now brittle, it's weak, it's not as strong. And so when you start chewing, especially if you're chewing on those back teeth for chewing and grinding, then you're setting yourself up for the tooth to crack and then to break. And then you think that the root canal didn't work, but you just have to protect your investment and put a crown on it.
And crowns are pretty easy. I mean, it's not like it's not like the root canal is a little bit more involved. It's a
Right.
process that you have to
Right.
go to put that filler in to protect the
Yes.
tooth. But you've got to be able to put that crown on it. And going and get the crown is just, it's the follow-up. It's the next step.
Yes, that's a definitive step. I always tell them a root canal, that's going to get you out of pain. That's going to allow you to eat that ice cream and sweets and whatever your desserts are without having any type of sensitivity. And a lot of patients like that, and that's where they stop. But that's not the end of the road.
Right.
You have to come back and you have to get that crown to protect that tooth.
And so just to recap a little bit, the root canal is one other way to save a tooth. And quite frankly, we should be doing everything we can to save teeth. We're going to talk a little bit of time, spend some time later talking about how and why people do lose their teeth. But
Yes.
we want to save a tooth if we can. A root
Yes.
canal is a way to do it. Misspell, the first myth is that the root canal is not where the pain is. It's the
Right.
infection.
The infection.
And you can treat that. And it's, the better we treat it, the earlier we treat that with some antibiotics, the better the anesthesia is going to work for that.
Yes.
And you
Yes.
got to do your follow through. You got to do
Have
your follow up
to.
and cover that tooth with a crown.
Exactly. That was perfect.
But there's a lot of situations where people either lose their teeth or they don't have any teeth in their mouth. A lot of reasons why that happens, right?
Yes. So when it comes to missing teeth, it's not always cavities.
Okay.
Cavities is a big part, but they're also because of trauma and also because of congenital defects. Some people
Okay.
are born missing teeth.
Right.
Okay. And for trauma, some people, whether they were in a car accident and they had to lose teeth in the front, or just because of any type of engagement running and the kids fall and they knock out a tooth.
Riding your bike, flipping over and landing on your face.
Exactly. Sounds
10
like a
10 years
personal
old.
experience.
Yes, ma'am. Yes, ma'am. These two are capped for that
Oh,
reason.
Beautiful.
Yeah, my
Very
dentist did a beautiful
natural.
job with it. Yeah.
Yes.
I break them occasionally.
Yeah.
But again, that's just, and again, caps is one of those things that they do because when you
Exactly.
have a partial tooth, you want to make sure that you can keep that tooth, right?
Yes, yes. And so with that, there's so many ways that the teeth can come out, but a lot of times when people come, they're a little embarrassed and they say, I don't want you to think I don't take care of my teeth. And so that's one thing that I want people to know, that we understand that it's not always about poor hygiene.
Right.
Sometimes it's just life. It's just whether it's a disease or medications, there's different things that happen that can contribute to losing teeth. And it's nothing that anyone should be ashamed of, because as dentists, we are here to make it better for you.
Right.
We are here to give you options so we can restore those teeth.
Right, and quite frankly, some of the things that we're figuring out is some of these advanced autoimmune disorders, some of
Yes.
the treatment for some of
Yes.
those really can impact the teeth. We know
Yes.
that cardiac problems, very difficult to manage because you want to make sure that you are talking with your dental provider, talking with your dentist to make sure
Yes.
when you have a procedure, because those two affect each other in a large way.
Exactly. They totally affect each other. What's going on in the mouth is going to affect the rest of your body. So the providers are always going to have to be talking and communicating, making sure also that whatever we do in the dental area, that it's not going to do anything that's going to harm you when you talk to your physician or you get your medical care.
Right, right. And just so inherently, some of that medical care can affect your teeth and can
Yes.
affect your dentistry, if you will.
Yes, yes.
And so people lose their teeth. It's normal.
It's normal. It's normal. It happens, unfortunately, but it's nothing that we cannot help. It's nothing that we cannot bring you out of.
And so let's talk about what some of those options are. I know you're excited to come and talk a little
I
bit about
am.
implants. Let's talk about the option for implants to replace teeth.
Okay, so implant is like the buzzword now. Everyone who comes to my office, they always want to ask about implants, okay? I like to call it implants and crown.
Okay, it's
Be-
both.
Yes, because an implant is comparable to a screw. It's a screw that gets placed inside of the jawbone, and you can't really see it. So when someone says they want to implant, they're really saying they want to implant and crown. The crown is the part that you see as a tooth. So when you want to implant and crown, I go over a few things I like to look for just to make sure you're a good candidate for
Okay.
it.
And the crown is to the implant just like the crown is to the root canal.
Exactly.
Okay.
Very much so. Very good. So when we do that, first thing we're going to look for, because when you place an implant, it is an invasive surgical procedure.
Right.
So first we want to make sure that the medical history is going to allow you to heal and recover as you need.
Okay.
The second thing, we want to make sure that you have enough bone to support it, enough
Gotcha.
bone to secure it in.
Right.
And so I like patients to know that just because you want to implant, we only want to do it if we know we're going to have a high success rate.
Right.
Okay. And so if those things are, all those are dotted I's and crossed T's, then we move on and we can do the implant, which have so many benefits. People like the implant because it's designed to be permanent.
Okay.
I don't have to drill on any of the other teeth with the implant. And also, with the implant, it looks natural. I don't have to worry about the other teeth in the mouth that's going to determine whether it's going to be successful or not. It operates independently.
And so there's an individuality, if you will,
Yes.
of doing that implant
Exactly.
and crown.
And crown.
Yeah.
Because if we do an implant without a crown, you still won't have a tooth to smile
That's
with.
exactly right. And you just have something in your bone.
Just exactly.
And something, and so you drill into that jawbone if the bone is viable, something
Yes.
you can use, and if it's going to be strong enough.
Yes.
So if those two things happen, then you can develop the crown that will go into it, and it gets sealed, it gets glued. Correct?
Right.
Glued in.
Now, the thing with implants, and I like for people to know, it is not an overnight success story.
It takes a while.
It takes a while. Once that implant is embedded, it's going to take 4 to 6 months so it can integrate and get in your bone. And you want that time. You want that time because you want that implant to be firm inside that bone, because that right there is going to keep it and have a high success rate. That can't be rushed.
Right. Not only the implant, but it's an implant and crown.
Yes.
And so I think you wanted to kind of finish up with that.
So we spoke about how you place the implant and it's going to need at least 4 to 6 months to heal. And by healing, I mean just to integrate into bone.
Right.
Afterwards, the patient will come back for a crown. This is an important visit. This is a visit everyone looks forward to because we're going to pick the shade. We will take impressions of the implant in that area, and you get to look around and pick the shade because we want that crown to look just like your natural tooth.
Sure.
We want to make sure that it's not just the shade that we like, but the shade that you like as well.
And that's a common theme. You listen to what your patients are telling you.
Yes.
And you devise plans for them based on what they see and feel and what their need is.
Yes.
And that probably goes into these other options for tooth replacement as well.
Definitely. Definitely. When it's all about, people get excited on the end result.
Okay.
But that process to get there, the patient has to be involved.
They got to be
They
invested.
have to be, exactly. You have to be able to find out what they want and what they need. I'm going to make sure that you're going to have a healthy dental experience. But I also want to make sure that I get what you want. I want that color to be what you want it to be.
Right.
So
Gotcha.
we're going to take that impression and we're going to select that color, send it off to the lab, and then a couple of weeks after that, I'll bring you back in, and then we place the permanent restoration because the crown, that's the definitive treatment. It's all over. You've done it.
Wow. And so there's a couple of other options other than the implant, right?
Yes. So everyone won't be a candidate for the implant.
Right.
Whether it's for finances, because it can be a little expensive with the implant.
Okay.
However, the next option is the bridge.
Okay.
Let's talk about the bridge. So the bridge is a way of filling in that missing area where there was a missing tooth. We fill in that area, but we use the neighboring teeth around the missing area to hold it in,
Okay. To secure it.
to secure it.
Right.
So essentially, the missing area will have a pontic, which is essentially a crown, and those abutment teeth, the ones that holding it in, we're going to put crowns on those as well.
Ah, okay.
So now we have a series of crowns, and they're all connected, hence the word bridge.
Okay. Wow. I don't think I ever realized that that's why it was called a bridge, that's the process.
Yes.
Okay.
And the bridges, a lot of the patients love it because just like with the implant and crown, you get to choose your shade, you get to be involved with the process. It's going to look natural as well. With it, unlike the implant, there's not any invasive surgery.
Okay.
You don't take it in and out your mouth. It's still going to be in there cemented. And unlike the implant, you don't have that long 4 to 6 months. You get to see the result in 2 to 3 weeks. It's composed of 2 appointments. In about a 2 to 3 week span, you're all done.
Okay. And it's just as permanent.
Just as permanent.
Right. But
yes.
It involves some of the other neighboring teeth.
Yes.
To strengthen and hold it in.
It involves neighboring teeth to strengthen and hold it in. Now, one thing about the bridge, if a part of the bridge does need a repair, you have to replace the entire thing.
Gotcha. Yeah. So it's just something that people need to be aware of. It's a little bit less expensive than getting the implant, but there's the risk that if it does break, then you have to replace the whole thing.
Exactly.
Okay. All right. So that's a good distinction between the implant and crown versus the bridge, which also has more than one, typically
series
3,
of crowns.
Right? Series of crowns, depending upon where it is in the mouth. And then there's the other option that's probably a little bit older.
Yes, and it's the more traditional option. It's the denture. If you're only missing a few teeth, then you will need a partial denture. Now, I do have patients that love this option because it's the most affordable.
Okay.
A partial denture is one fee, and it doesn't matter if you're replacing 3 teeth or replacing 7. It's still going to be that same fee.
Oh, wow. Okay. So it's very cost efficient.
Very cost efficient, especially if there's several different teeth in the mouth that you want to replace all at the same time.
Okay.
Now, one of the things that I get from my patients when I say about the partial denture, they say that I've seen people have it and they have that silver wire in their mouth. And so what I tell them, dentistry has evolved so much. We no longer have to have the silver wire hook or the clasp to hold it in.
Okay.
Now it's way more cosmetic. We can have it pink that it matches your gums and it can still give you that same retention. So now there are different types and different materials used to make the partial dentures, so it can be that same natural look and you get that same good feeling because you know it looks good in your mouth.
And again, all of these options are about really for the patient wanting to feel good about whatever it is that they're doing and that they're happy with the end result.
Yes. No option for one patient will be the same, whether it's because of your medical history, whether it's because if you have bone disease or gum disease, or if it's because of finances. But the most important thing is to know, despite of your situation, there is an option that can suit you. There is not just one way to replace teeth. There are several ways.
And it's come a long way, kind of like you mentioned. I mean, the option for an implant we didn't have till 10 or 15 years ago.
Exactly.
And so it's something that's a new option. Now these dentures don't have to have that wire to connect things. It's a much more advanced process. The bridge can match up so much more beautifully with the other teeth than it used to.
Yes, and you can even combine the options. For complete dentures, you can now have an implant retained denture to give it extra way of keeping it in and security. So there's so many options now to replace missing teeth.
And so we've kind of talked about the importance of what a root canal is or isn't.
Yes.
The importance of being able to do the follow-through appointment for it. And then if people are missing teeth, one that we maybe can't save from a root canal, that there are several different options to when the teeth are gone to replace them with implants, bridges, and dentures.
Exactly.
Very good. Well, Dr. Hanley, I can't thank you enough for coming on and sharing with us today. We always enjoy you being on the program.
It is my pleasure. Always my pleasure.
All right. Thank you so much. All right. That'll do it for this Bayou Time. Don't go anywhere. A whole lot more local programming when we continue.